Good day everyone, this is the Group 4 video presentation. For today's video, we are going to report the Module 12, the Emergency Rescue Transfer, and the Module 13, which is the Fundamentals of Bandaging. So first, we are going to tackle the Emergency Rescue Transfer. So what is the Emergency Rescue Transfer? This will help you to know the different methods and the proper ways of carrying or transferring a victim or patients in consideration of the injuries they suffered. So, sa lesson nga dya, giya naton mabalaan ang mga pamaagi nga insakto kung paano naton ihakwaton kag isaylo ang patient considering of their injuries. Emergency rescue is the rapid movements of victims from an unsafe place to a safe place. Ang madasig nga pagsaylo kang victim sa safe nga lugar. Pero dapat balaan mo kung ano ang proper ways nga pag-carry or pag-transfer kang victim. If you don't know, you must not do it kay base maglala lang ang injured kaaton patient. Transfer refers to the moving of a victim from one place to another after giving the first aid. So, after mo isaylohon ang victim sa isa ka lugar, make sure nga natawan mo anay first aid. Dragging refers to the act of the rescuer or cautiously pulling a victim by the shoulders or feet on a smooth ground. This is usually done kung isa lang ang rescuer kag hindi sapat ang kakayanan para hakwaton ng aton victim. Pointers to be observed during transfer. 1. Victim's airway must be kept open. 2. Prevent hemorrhage to avoid shock. 3. Victim should be safely maintained in the correct position. 4. Regularly check the victim's condition. 5. Supporting bandages and dressing should be effectively applied. 6. The method of transfer is safe, comfortable, and as speedy as circumstances permit. 7. The patient's body should be moved as one unit to avoid injury at the joints and extremities. 8. The taller first aiders should stay at the head of the victim. 9. First aiders must observe ergonomic in lifting and moving the patient. Now, let's go to the methods of emergency rescue. A. One-man carry methods. 1. Lovers carry or carry in arms. Commonly used by any person in carrying or transporting another. 2. Fireman's carry. Used when there is no injury or there is near the abdomen. 3. Pack strap carry. Usually used to carry victim for a short distance. 4. Piggyback carry. Used to transport victims for longer distances. B. One-man assist or drag methods. 1. Assist to walk. Usually done to assist a person who cannot walk by himself or herself due to the injury or illness. 2. Cloth drag. Used when the cloth is available. The surface of the ground should be smooth when performing this drag to avoid further injury to the victim. 3. Feet drag. Used when the ground is smooth by fixing the hands and dragging the victim by the feet. 4. Armpit or shoulder drag. Used to drag a victim by the armpits away from an unsafe place. 5. Blanket drag. Used when the victim is lying on a blanket, done by holding the ends of the blanket and gently dragging the blanket carrying the victim. 6. Fireman's drag. Done in a building that is burning and that the victims are confirmed to be still inside. The rescuer crawls at estimated 1 foot on the floor and look for victims to rescue. Used to avoid smoke inhalation injuries while rescuing during a fire. 7. Inclined drag. Used when transporting a victim, especially on stairways. Always elevate the head of the victim while walking to prevent him or her from losing consciousness. C. Two-man assist or carry methods. 1. Forehand sit, used when the victim is conscious. 2. Hands as a lifter, applied when the victim is not conscious. 3. Carry by extremities, applied when injuries of victim are at the body parts except the hands and feet. 4. Assist to walk, applied when a person cannot walk alone, especially for persons under the influence of liquor or drugs. 5. Chair carry, methods of carrying the victim by letting him or her sit on a strong chair and letting at least two individuals carry the chair with the victim on it. 6. Fireman's carry with assistance, used when there are a lot of victims who need immediate transfer from an unsafe place to a safe place. D. Three-man carry methods. 1. Hammock carry, used to carry a victim who cannot be carried by a single rescuer because of heavy weight, nature of injury, and nature of terrain. This method of transporting a victim is ideal for wide alleys. 2. Barriers alongside, usually used in narrow alleys. The rescuers carry the victim along one side of the victim. The victim is clipped against the chest of the rescuers to avoid falling and further injury. Other methods of emergency rescue. E. Improvised stretchers using two poles. Materials: blanket, empty socks, shirts or coats, triangular bandages. F. 4, 6, 8-man carry, can be done when the weight of the victim or patient cannot be carried by 1 to 3 persons. Procedures is the same with 3-man carry. G. Blanket carry is different from the stretcher in that it uses a blanket with poles, done by proper insertion of blanket under the victim, testing the blanket and lifting. H. Commercial stretcher, a ready-made stretcher designed for the purpose of carrying a victim or patient. I. Ambulance rescue van. Most ambulances are designed with stretchers inside that can be folded to serve as a bed for patients or victims. Others may also be used as rescue vehicles for the purpose of transferring the victims. Initial triage and tagging. Triage and tagging are done to prioritize victim in a mass of disaster such as a plane crash, vehicular accident, earthquake, massive landslide, flood, fire, and the other natural or man-made disasters. It also refers to the method of transport based on the severity of injuries and medical emergencies. Red tag, first priority. The victim has a life-threatening or serious injury that needs immediate first aid and rescue. Yellow tag, second priority. The victim has a less threatening injury and care can be delayed within 1 hour. Green tag, third priority. The victim can walk on his or her own. Rescue or assistance of victim may be delayed. Black tag, fourth priority. No care is required. The victim is dead or close to death. All victims tagged with black shall be the last priority during rescue operations. Now let's go to the Module 13, which is the fundamentals of bandaging. In fundamentals of bandaging, rescuers and first aiders must be trained on bandaging techniques. So why it is important to know the bandaging techniques? Bandaging is a basic procedure, but if carried out incorrectly, it has the potential to cause considerable harm. For example, by restricting movement or blood flow. The most recommended type of bandage is a triangular bandage because it can be used in many ways. Now let's go to the definition of terms. 1. Dressing. A sterile pad, a compressed sponge, or any other materials that is clean and directly applied to cover the wound. The importance of dressing the wound is to protect the wound from the environment, protect the wound from soiling with body fluids or waste, immobilize the injured body part, and also promote wound healing. 2. Bandage. A strip of material such as gauze used to protect, immobilize, compress, or support the wound or injured body part. The importance of bandage is covering a break in the skin helps to control bleeding and protect against infection. Dressings are pads of gauze or cloth that can be placed directly against the wound to absorb blood and other fluids. 3. Splint. A first aid device used to immobilization, usually made of wood. The main purpose of splinting is to immobilize the joints and bones above and below the fracture site. This is to prevent bone edges from moving and damaging other muscles, vessels, or nerves and further complications. 4. Sling. A device used to support or immobilize an injured part of the body, usually a piece of cloth. A sling is a device used to support and keep still an injured part of the body. Slings can be used for many different injuries. They are most often used when you have a broken or dislocated arm, elbow, or shoulder. 5. Triangular bandage. A piece of cloth material that can be utilized in an emergency. Practically, it is the most readily available since you can convert any clothing material into a triangular bandage in the event of an emergency. A triangular bandage is also used as an arm sling or as a pad to control bleeding. It may also be used to support or immobilize an injury to a bone or joint or as improvised padding over a painful injury. 6. Ruler or elastic bandage. A stretchable bandage used to create localized pressure onto an injured part of the body. It may be used to control bleeding or to immobilize the injured part. A ruler bandage is also used to secure a dressing in place. 7. Cravat. A basic first aid item that can be used as both a bandage and a sling. It is also a folded triangular bandage. The cravat is a multi-purpose triangular-shaped textile that can be used to support injuries, immobilize fractures and dislocations, or even bandage wounds. Parts of the triangular bandage. 1. Ends are the two end points of the triangular bandage other than the apex. 2. Sides refer to the two sides of the triangular bandage in between the apex in the two ends. 3. Apex refers to the opposite of base of a triangular bandage. 4. Base refers to the opposite of apex of a triangular bandage. Pieces of a triangular bandage. 1. Open pace. With a triangular bandage in open pace, it can be applied to the following parts of situation. A. Head, top side. B. Face, back of the head. C. Chest, back of the chest. D. Arm sling. E. Underarm sling. 2. Cravat pace. This includes narrow, semi-wide, and wide grabat phases of the triangular bandage depending on the affected body part of the victim. A. Forehead, eye. B. Ear, cheek, jaw. C. Shoulder, hip. D. Arm, leg. E. Elbow bent. F. Elbow straight. G. Knee bent. H. Knee straight. I. Palm pressure, vertical injury. J. Palm bandage, horizontal injury. K. Sprained ankle, shoe on. L. Sprained ankle, show off. M. Cravat sling. N. Male or female organ bandage. Now let's go to the photographs and steps of different bandaging techniques. Arm sling. A. Apply a sling to an arm. This arm sling is used when the shoulder of the injured arm is not injured. 1. Insert the triangular bandage between the injured arm and the casualty chest so the arm is in the center. The apex of the sling is beyond the elbow and the top corner of the material is over the shoulder of the injured side. 2. Position the forearm so the hand is slightly higher than the elbow. 3. Fold the material along the base, back to the casualty fingers, forming a cuff. 4. Bring the lower portion of the material over the injured arm so the bottom corner goes to the shoulder of the uninjured side. The elbow should be inside the sling. 5. Bring the top corner behind the casualty neck. 6. Tie the two corners together in a non-slip knot at the hollow at the neck on the uninjured side. If the casualty's right arm is fractured, for example, tie the knot so it will rest in the hollow on the left side of his neck. 7. Secure the apex of the sling to keep the elbow and forearm from slipping out of the sling. A. Safety pin method. Fold the apex forward over the elbow and sling. Pin the apex to the sling. B. Pigtailing method. Twist the apex of the sling and tuck it in at the elbow. B. Apply a sling to an arm. Arm sling number 2. This arm sling is used when the shoulder of the injured arm is also injured, dislocated, or fractured. Note that the sling goes under, not over the injured shoulder. 1. Insert the triangular bandage between the injured arm and the casualty's chest so the arm is in the center. The apex of the sling is beyond the elbow, and the top corner of the material is over the shoulder of the uninjured side. 2. Position the forearm so the hand is slightly higher than the elbow, about a 10-degree angle. 3. Fold the material along the base, the long side opposite the apex, back to the casualty's finger, forming a cuff. 4. Bring the lower portion of the materials over the injured forearm and under the armpit of the injured arm. The elbow should be inside the sling. 5. Bring the top corner behind the casualty's neck. 6. Tie the two corners together in a non-slip knot on the casualty's back between his shoulder blades. 7. Twist the apex of the sling and tuck it in at the elbow. The corner can also be secured using a safety pin or similar device. Shoulder bandage. 1. Take one bandage across the chest and the other across the back and the under the arm opposite the injured shoulder. 2. Tie the end with a non-slip knot. Hand bandage. 1. Place the hand in the middle of the triangular bandage with the rest at the base of the bandage. Ensure that the fingers are separated with absorbent materials to prevent cuffing and irritation of the skin. 2. Place the apex over the fingers and tack any excess material into the pleats on each side of the hand. 3. Cross the ends on the top of the hand, take them around the wrist, and tie them with a non-slip knot. Chest or back bandage application. The chest bandage application can also be applied for the back. What is shown below is the application for the front. Simply do the same steps on the back if the bandage is to be applied for back injuries. 1. Locate the apex of triangular bandage. Place on the shoulder above the affected chest. In this case, the affected side is the right side. It follows that the apex will be on the left shoulder if the left side of the chest is the injured side. 2. Bring the 2 points at the back, making some adjustment of the base of triangular bandage. 3. Make a first square knot at the back of patient. Make sure the knot should be aligned with the apex of triangular bandage. 4. Make your second square knot using the longer point of the apex. 5. Hide the access points of the square knot, housekeeping purpose. 6. Make some adjustments on the base and sides of the triangular bandage by folding them outside. This will tighten the bandage and will hold the dressing in place. Open palm bandage. The open palm bandage application is applied when the injury on the palm is in vertical or diagonal position. It follows that closing the hand of fist will create more opening of the wound, and this is the reason why the hand is kept open while the bandage is applied. 1. Lay the middle of the cravat over the palm of the hand with the ends hanging down on each side. 2. Take the end of the cravat at the little finger across the back of the hand, extending it upward over the base of the thumb, then bring it downward across the palm. 3. Take the thumb and across the back of the hand, over the palm, and through the hollow between the thumb and palm. 4. Take the ends to the back of the hand and cross them, then bring them up over the wrist and cross them again. 5. Bring both ends down and tie them with a non-slip knot on the top of the wrist. Leg, upper and lower bandage. 1. Place the center of the cravat over the dressing. 2. Take one end around and up the leg in a spiral motion and the other end around and down the leg in the spiral motion, overlapping part of each preceding turn. 3. Bring both ends together and tie them with a non-slip knot. Knee bandage. 1. To apply a cravat bandage to the knee is illustrated in the figure. Use the same techniques applied in bandaging the elbow. The same caution for the elbow also applies to the knee. Foot bandage. 1. Place the foot in the middle of the triangular bandage with the heel well forward of the base. Ensure that the toes are separated with absorbent materials to prevent cuffing and irritation of the skin. 2. Place the apex over the top of the foot and tack any excess materials into the pleats on each side of the foot. 3. Cross the ends on the top of the foot, take them around the ankle, and tie them at the front of the ankle. First head bandage. 1. Turn the base longest side of the bandage up and center its base on the center of the forehead, letting the point apex fall on the back of the neck. 2. Take the ends behind the head and cross the ends over the apex. 3. Take them over the forehead and tie them. 4. Tack the apex behind the cross part of the bandage and or secure it with a safety pin if available. Second head bandage. 1. Place the middle of the bandage over the dressing. 2. Cross the two ends of the bandage in opposite direction completely around the head. 3. Tie the ends over the dressing. Air bandage. Lacerated or a bull's air tissue may not in itself be a serious injury. Bleeding or the drainage of fluids from the air canal, however, may be a sign of a head injury, such as a skull fracture. Do not attempt to stop the flow from the inner ear canal, nor put anything into the ear canal to block it instead. You should cover the air lightly with a dressing. From minor cuts or wounds to the external air, apply a cravat bandage as follows. 1. Place the middle of the bandage over the ear. 2. Cross the ends, wrap them in opposite directions around the head and tie them. 3. If possible, place some dressings materials between the back of the ear and the side of the head to avoid crushing the air against the head with the bandage. Jaw bandage. Before applying a bandage to a casualty's jaw, remove all foreign materials from the casualty's mouth. If the casualty is unconscious, check for obstruction in the airway. When applying the bandage, allow the jaw enough freedom to permit passage of the air and drainage from the mouth. Note: the dressing and bandaging procedures outlined for the jaw serves a twofold purpose. In addition to stopping the bleeding and protecting the wound, it also immobilizes a fractured jaw. 1. Place the bandage under the chin and carry its ends upward. Adjust the bandage to make one end longer than the other. 2. Take the longer end over the top of the head to meet the short end at the temple and cross the ends over. 3. Take the ends in opposite directions to the other side of the head and tie them over the part of the bandage that was applied first. And that's the end of our report, guys. I hope na may naintindihan kamo sa amon nga report. And also, thank you sa pagpamati.